Pancreatic cancer. Why this cancer is so dangerous. Deep inside your abdomen, hidden behind the stomach, sits a small organ with enormous responsibilities, the pancreas. It helps your body digest food and regulate blood sugar. But when cancer begins here, it can become one of the most difficult cancers to detect and treat. Pancreatic cancer often develops silently. In its early stages, there may be few or no obvious warning signs. And because the pancreas lies deep inside the abdomen, early tumors can be difficult to detect during routine examinations. Meanwhile, abnormal cells can continue multiplying. The tumor may grow unnoticed until it begins interfering with nearby organs, blood vessels, nerves, or bile ducts. Then, the warning signs may begin. A person might experience unexplained weight loss, loss of appetite, fatigue, abdominal or back pain, nausea, or vomiting. One particularly noticeable sign is jaundice, yellowing of the skin or whites of the eyes. A tumor near the head of the pancreas can block the bile duct, causing bilirubin to build up in the body. This may also lead to dark urine and unusually light-colored stools. But here's the frightening part. These symptoms can resemble many other, much more common conditions. By the time pancreatic cancer produces obvious symptoms, it may already be large or have spread beyond the pancreas. When cancer spreads, the liver is one of the organs it can reach. And once cancer has spread, surgery may no longer be able to completely remove it. This is a major reason pancreatic cancer has such a serious prognosis. Current US data reported by the American Cancer Society show a 5-year relative survival rate of about 44% for localized disease, compared with 3% when the cancer has spread to distant parts of the body. These are population statistics, not predictions for an individual patient. Scientists have identified several factors associated with increased risk. Smoking is one. Other factors include excess body weight, chronic pancreatitis, diabetes, family history, and certain inherited genetic conditions. But having a risk factor does not mean someone will develop pancreatic cancer. And some people develop the disease without an obvious known risk factor. When pancreatic cancer is discovered early enough and can be completely removed, surgery can offer a chance for long-term survival. Depending on the cancer's location and stage, treatment may include surgery, chemotherapy, radiation therapy, targeted therapy, or combinations of these approaches. Doctors may use CT scans, MRI, endoscopic ultrasound, biopsies, and other tests to diagnose and stage the disease. And medical research continues to search for better ways to detect pancreatic cancer earlier and treat it more effectively. Pancreatic cancer is dangerous not because it always announces itself loudly, but because it can remain hidden while the disease progresses. Unexplained weight loss, persistent abdominal or back pain, jaundice, dark urine, unusual digestive problems, or other concerning changes should not be ignored. These symptoms are often caused by conditions other than cancer, but persistent or unusual symptoms deserve medical evaluation. The earlier a serious disease is discovered, the more opportunities doctors may have to treat it. This video is for educational purposes only and is not a substitute for professional medical advice. Thanks for watching. See you in the next videos.
Mapping the future of medical science. Every cell is restored to perfect health, unlocking the body's incredible power to heal.